Hello, everyone, and welcome to the Healing Our Children 2018 World Summit. I'm Alison Morris from Full Potential Parenting, and I want to welcome you to another interview. Today, my guest is Megan Caper, and Megan is a medical intuitive, and we're going to talk about what that is and what that means. She's also an author and a speaker who has helped hundreds of clients who are frustrated with the lack of diagnosis or limited treatment options offered to them by their doctors. So Megan uses her psychic abilities and medical training to look inside the physical, emotional, and energetic body, find the root cause of illness, and set clients on the road to true healing. And we'll talk about where you can reach her and what sorts of services she offers and all that good stuff when we get a little bit further into our interview. So welcome to the summit, Megan. I'm so happy to have you here.
I'm so happy to be here. Thank you, Alison.
Yeah, so a medical intuitive, that may be a new term for a lot of people.
Yeah.
And so I think we should probably just start with what the heck is medical intuition?
Sure. And I've actually heard this term used by different people. I'll say what it means to me. So I have, basically I'm psychic and I have a medical background, both in traditional Western medicine. I have a master's degree. And then also I've studied all sorts of alternative healing modalities. So Eastern Chinese medicine, Ayurvedic medicine, things like that. So I use the combination of my medical knowledge and my psychic abilities it's almost like I have an MRI in my head. And I can go in and actually look and see what's going on and get all sorts of intuitive information and then sort of match that up with the symptoms or diagnosis that the client has told me about and really figure out what's going on. So it could either be that you can't get a straight diagnosis or you've had multiple diagnoses from different doctors and you feel like you haven't gotten, and I can really sort of get down to what's going on. Or there's a lot of diagnoses that sort of describe symptoms but don't tell you why. So something like...
Yeah, I was going to say that. Yes.
Yeah.
So the diagnosis isn't actually tell you much except that there's inflammation of something, for instance, but nothing about why.
Yeah, in medical terminology, the suffix itis, which you hear all the time, bursitis or appendicitis, itis just means inflammation of whatever you said before. But why? You know, why do some people get appendicitis and others don't? Why do some people have chronic fatigue and others don't? And it's not the same for everyone. I mean, I think everyone knows that chronic fatigue for one person is not going to be the same as for another person, or fibromyalgia. They're going to be different reasons. So, that's another reason my patients come to me, is because a lot of the treatment that Western medicine offers is just medication for those symptoms, but isn't really curing them or figuring out the why. So I can also get down to the nitty-gritty of the why and hopefully help the person make some shifts so that the condition really clears up for good.
Are there, well, let's not, I'll save that for later. So how do you generally work with clients then? What kind of information do you like to get? Are you starting with a completely clean slate, or are you gathering a lot of information first before you sort of tune into somebody and see what's going on?
Yeah, that's a good question. So different psychics work different ways and have different abilities. My sweet spots tends to be when I have a lot of the background information, the factual information, what I call the left-brained information, and then my right brain steps in and goes, oh, well, this is what's going on. But it sort of needs that foundation of talking to someone and really getting their health history, especially because a lot of times if you've been told you have a certain condition and I ask you what your symptoms are, you'll just tell me the ones that fit into that checkbox because that's what your doctor has told you your symptoms are. And all this other stuff that's going on, you maybe have been told it's not part of your syndrome or something else. So I want to get all of that information because to me, it's important to get a picture of everything that's going on with the person, even if they don't necessarily think it's related. So I get that sort of, we talk for, about an hour and I get that sort of information from them, do a whole health history. We chat about what's going on. And then it sort of depends. If it's a condition I've worked with a lot before, sometimes in the moment, I'll start getting intuitive hits. I call them downloads because they just sort of pop into my brain. And I'll be able to give you information. But if it's symptoms I've never really come in contact with before in that combination, or sometimes people will come to me with a really rare condition that I don't know of. In that case, I'll go off and do a little more research on my own, read medical journals and things like that, and get all that left brain information I need. And then we'll have a second session where I come back and give them my intuitive hits on what's going on, and also what modalities would be most helpful for them. One of the things I'm trained in is applied kinesiology, so I can actually go through and muscle test what's going to be the best treatment option for whatever's come up during our session.
So muscle testing is something that we've not had a full session on here at the summit, I think, ever before. We've dealt with it a little bit in another interview at this year's summit, but can you give people just a little bit of background about what muscle testing or applied kinesiology is? Because I think it's pretty fascinating, and
yeah,
I'd
it's
love
pretty
to hear
cool
more
actually.
about it.
So if you go online and go to YouTube and Google, you can see someone doing sort of the classic where someone holds their arm up and then someone else is trying to push it down. And sort of the classic experiment they do is they'll say something, they'll tell the person to think good thoughts about themselves, like I'm strong and I'm smart and I'm courageous, and they'll try to push their arm down and nothing will happen. And then they'll have the person think thoughts like, oh, whatever that inner critic says in your mind, like, oh, nobody likes me, I'm worthless, whatever that is. And then you'll try to push that person's arm down with the same amount of force and it just goes boom. And so what it is that our bodies hold sort of information about our belief systems that you can access through muscle testing, which is that pushing down on the muscle. There's other ways to do it that don't involve the arm. And so what I'm doing with muscle testing is I'm connecting to the person's innate wisdom. So not what their brain thinks is wrong or is going on, but what their body knows. I mean, and our body has, 4 trillion chemical reactions every second that are going on. So there's a lot of information for your body to keep track of, and it knows everything that's going on all the time. And so when I'm muscle testing, I'm accessing that knowledge. I'm accessing that innate wisdom that we all have. When I do it, because I only work online at this point, I don't see clients in person. What I do is I muscle test on myself, but I'm asking for it to represent the person that I'm working on. And it does work because I'll get all sorts of information about medical conditions that I don't have. So I know it's not about me. And I'll get recommendations that way.
Yeah, it's so fascinating. And of course, the key with muscle testing is kind of reliability, validity, all that good stuff. And so it's something that obviously people work on quite a bit before they can sort of trust that the information they're getting really is accurate, right?
Exactly. Yeah.
And it helps, of course, when you're doing it for somebody else, because then you're not emotionally invested in what the outcome of the answer is.
Totally. Yeah.
Yeah.
I mean, I can do it on myself, but you're right. I don't trust it as much for doing it for me as I would for somebody else. I also use it just personally because I do get these sort of psychic downloads and I want to also make sure that I'm on the right track. I'll use it to double check that I am on the right track. So I'll muscle test yes or no, or if there's more information or more detail that I need to get into, I'll just muscle check for that. So I use it also for myself to help with the psychic information that I get.
Okay, well, great. And we don't need to go too much more into that. I just sort of as a fascinating aside.
Yeah.
So I think probably a lot of people are curious about just what sort of, like both how you're getting the information and what kind of information you're actually receiving. Could you tell us a little bit more about how that works?
Sure. I guess the best way to go about that is to tell you the story of sort of how I figured out that I had this ability, which started with my own health history. So about 15 years ago, I was lying in bed, trying to get myself to go to sleep, and I was just sort of absent-mindedly rubbing my belly, and all of a sudden my hand got over this one spot, and all that other mental chatter in my head just went silent, just dead silent. I heard my own voice, but incredibly calm and authoritative and wise. And it just said, there's going to be something wrong here. And I sort of went, well, that's odd. Okay, what do I do with that information? Do I go to the doctor? Like, I don't know what to do with that. So I just sort of filed it in the back of my head. Nothing happened. I would sort of, put my hand over that spot every now and again and see if I would get any information. Nothing happened. And then about 5 years later, same thing happened. My hand was over that spot on my belly, and that same thing, all the mental chatter, everything stopped. I heard that voice. There's something wrong here now. and got a little bit freaked out. About 6 months later, I started having some stomach pain in a different spot. And about 6 months after that, I ended up getting diagnosed with colon cancer. And it was right in the spot where my hand had been when I heard that voice.
Oh, wow. Okay.
Yeah, so that sort of blew me away. My background was very scientific, so I was immediately curious of like how, so something in my body knew cancer was there. When I had my surgery, I then asked my doctor afterwards, I'm like, well, about how long had the tumor been there? And he said, oh, probably about 5 years based on its size and everything. And that's exactly when I heard the voice. So I was fascinated by, my body knew that something was wrong. Hello, kitty. How did it get that information to my head, and how did I hear that voice? And so I started doing some training to figure out sort of what was going on and how I could harness that both for myself and for others. So now the information that I've gotten, now that I've taken a bunch of classes and sort of developed that skill, I still hear that voice. That's definitely one way I get information is verbal. Like I said, it's like I have a movie in my head, and a lot of times I'll see visual information. I'll be able to zoom in on different body parts or different aspects of people, or zoom out. I'll see energy, or I'll see something physiologically that's going on. So I get a lot of information that way. And sometimes I get information in my own body. I'll start feeling something and I'll be like, wait a minute, I don't have back pain. Why am I feeling back pain? And I'll ask, is this mine or is this the client's? And it'll be the client's. And I'll ask the client, like, do you have lower back pain? And they're like, yeah. So sometimes I'll get information in my own body that way too. So those are the three main ways I get that information. And like I said, ever since that first time when that happened to me, I was just so curious, because this was so out of the realm of my normal experience, having been pre-med and growing up with my dad's a doctor, and, you know, I was very scientific, that I like felt like I have to know how this works. So I've developed the skills since then.
Well, that's a fascinating story. And have you since had other, what's the word I'm looking for? I assume then you spent a lot of time sort of confirming that the information you're getting is accurate as you work with people, and, you know, they say, yes, that's exactly right, or we tried this treatment and that helped with this, or we did go get this test and it confirmed what you said. Because I think probably a lot of people are like, that's crazy. How could I ever trust that what she, which information she would get
I know. And,
you know?
I will just say, you know, people are like, well, what do you say to skeptics? And I say, like, I'm such a skeptic. I consider myself an open-minded skeptic, but I was completely skeptical of this stuff when I first was introduced to it. I didn't necessarily know if it would work. But then I started seeing results that were statistically way more than just coincidence could be. You know what I mean? Like, if it was working even 50% of the time, I would have been like, yeah, well, maybe just some good guesses. But these were things that, 80% of the time I was spot on, 80 to 90% of the time. I'm trying to think of some things that, like, I had a client recently who came to me because she was coughing and there's something going on with her lungs, but the doctors couldn't find anything in her lungs. She'd been taking all these tests, and I tuned in and I'm like, I'm really seeing your esophagus is the first thing I saw was her esophagus. It just jumped out at me. I was taken right to a visual image of her esophagus. So I was like, I really think you should go get your esophagus checked out. And she was like, oh, okay. Well, so she ended up booking an appointment with a gastroenterologist, and they did an endoscopy, and lo and behold, the issue was really with her esophagus, that had some inflammation and some other things going on. So, you know, just story after story like that, where there's no reason I should have necessarily told her to get her esophagus checked out. And you know what I mean? Like, I'm trying to think, so that was physical. A lot of times, other times I'll just be talking to someone and I'll just get this feeling that, especially with autoimmune diseases, a lot of times there's an emotional component or a belief system component. And I'll just all of a sudden get this hit of like, well, it seems like you're seeing the world like you did when you were a child and your father did blah, blah, blah. And just even that realization, I'll hear back from them a week or two later, like, oh my God, I never realized how much I was still living in that reality and that belief system. And now that I've sort of started seeing that, my symptoms are clearing up. So It really depends on the client. I'm not ever going to say that I'm 100% accurate. I think any psychic that claims they're 100% accurate, I mean, I'm a human being. I'm getting information from somewhere, the cosmic field, the universe, whatever, but it's coming through my filters as a human. We all have filters. I'm never going to claim that I'm 100% accurate, but I'm well more accurate than chance would be. And I've been doing this for 10 years, so.
Yeah, interesting. Well, and now there's another part of your background that we didn't talk about earlier, which is that you have quite a bit of experience working with children, right, as an occupational therapist. Is that correct?
Yeah.
Yeah. And so can you tell us a little bit about how much you've had the chance to work with children, and is it any different working with them than with adults? Obviously, sure. I think you're getting most of the background information from parents, so it's through the parents' filter.
Right.
Or as often is, it's other filters from just, maybe traditional Western medicine of diagnoses and, again, maybe some test results that indicate X, Y, or Z, right? But right. Tell us about working with children.
Sure, yeah. I have my degree in occupational therapy, and I've worked with children in the school district and also in private clinics for years as well. And when I'm working with children as clients in my medical intuitive services, it really depends. So if the child is old enough and verbal enough that I can have a conversation with them, I usually have a conversation with both the parent and the child, because I do want to sort of get as much information as I can. If the child's either too young or they're nonverbal, I'll just talk to the parent. But what I'm able to do is I get into sort of almost like a meditative state, and I'm able to plug into someone's energy. And this is how I get the information. It's almost like, this is going to tell my age, but like in the old times when there were those telephone operators that would plug in, the different things, to get somebody on the line. It's almost like I plug into someone's consciousness, for lack of a better word, their innate wisdom, and then I'm able to get all this information. I have them on the line. So when I'm working with children, I'll get into a meditative state. And this usually, again, is why sometimes I need to have 2 calls, because in order to get really deeply into the state, I sort of need to have all the other sensory input shut down. I just need to be on my own. I'll plug into their energy, and I'll just ask to be able to be guided to what's going on with them. So that's how it works with children is I always talk to the parent too, just because I want to get the perspective of the parent. They're also usually a little more knowledgeable about the medical terminology and the diagnoses and all that, and the health history. But then I'll also talk to the child if I can, and then I'll go off and sort of just tune into the child's energy and get the information that way.
And have you sometimes come up with information then that is really dramatically different from what the diagnosis is, so that it, your information is that, they've been given this, but what I really see is going on is this. Now, I know, like with a lot of our kids, at least on the emotional or the psychological stuff, those are all, again, just categories of symptoms. There's not like a blood test for oppositional defiant disorder, or reactive attachment or ADD or any of those things that, are turned up in the DSM, whatever version we're up to now.
Right.
But even things like leaky gut, now if it's that somebody's got neurotransmitter imbalances, well, you know what, even then I'm not sure that you can quite tell directly. I think those are even indirect tests.
Yeah.
But I'm just sort of wondering, like, so are you more often coming up with the, like, here are some emotional issues that might be contributing to this, and here are some ways that you haven't yet been told about that in fact might help with helping the child move through this?
Yeah, for sure. When it comes to things like leaky gut or whatever, those are the kind of situations, like I said, where I'm usually more finding out the why. Usually the medical tests are right, but they don't necessarily tell you why. So what I'm coming up with is the why. And in order to really treat something, you kind of need to know what the cause is. I mean, you can treat all leaky gut with the same medication, or even all, emotional symptoms. If you treated all depression with the same medication, I mean, we know already it doesn't work for everybody, right? The same medication doesn't work for everybody. So I feel like when I go in and I find the why, it really helps to tailor sort of what specific treatment options you look at for that particular issue. But in answer to your question, no, it's not usually radically different, because what I'm asking people is not just for diagnoses, but for symptoms. And the symptoms are the symptoms. Those aren't going to change. So is the diagnosis sometimes a little off? Yes, according to what I get. But usually the symptoms are the symptoms. So whatever I'm coming up with is still addressing the symptoms.
Got it. And so we actually went through this exercise in a sort of a mini version of this with my daughter. In part, just so I had a better sense of kind of what this process looked like and the kind of information that you're able to get. And so just so folks know, so we chatted. Actually, no, I think I sent you an email initially just with a series of some of the background on my daughter and some of the things that she's still struggling with. And then did we talk some, or then you just talk directly with her?
I just talked to her, yeah.
Right. Where you got, let's be honest, she's 12, not a girl. Not a lot of really insightful medical information, but you got more just from connecting with her.
Pulling it out because she was nervous to talk to me, as she should be, and this kind of standard response of a 12-year-old to any question, I don't know, so there was a lot of I don't know, and I had to sort of tease out, oh, what about if we look at it this way, so I was able to get some information out of her, but it was not as forthcoming as if I'd been talking to an adult. I'll just say it that way, which is again normal for kids. That's just
right. Right. And then I confess, and I'm trying to remember what happened next. Did we have then a conversation after that, or you were actually just based on that, you were able to put together just a series of things?
Yeah, because like I said, it's a combination of hearing the symptoms and the left-right information, but when I'm talking to someone, I'm also tuning into that energy. So even when I wasn't able to get as much sort of factual information out of her, I was still able to tune into her energy after that call and just intuitively get some information about what was going on.
Right, and I'm just actually looking up right now because I think this was so fascinating. So then you sent an email, and I don't know if this is generally speaking what people would get is they would the sort of information that they would get from you is an email or a phone call or something.
Usually I'll do both. So we'll have a phone call and I'll tell them what I got, and then I'll send them a report afterwards that details sort of what we went over. And also if there's any additional information, like you and I actually ran out of time. So I just added that extra information in the email. So that happens sometimes too.
Right. And
other insights I get after the call, I'll put that in too.
And so what I found, so I got, again, some sort of three sort of main areas that where you were able to provide some information. And one of them in particular that I thought, again, was really interesting, which had to do with sort of less than ideal absorption of minerals and vitamins in her gut, which didn't surprise me at all because I've known that she's sort of deficient and doesn't take stuff in terribly well in a couple different areas. But what I found so fascinating was, again, this sort of emotional component that you kind of picked up on. That had to do with sort of a belief about not feeling like that she deserves to receive or absorb love or attention. So it's sort of almost like her belief system then affects her own body's ability to absorb
Yeah.
what she needs.
Oh, for sure.
I mean, in a very physical
In a
way,
very
not
physical
just
way.
emotionally, but vitamins and minerals. And I found that to be really fascinating and probably correct.
Yeah, our bodies don't, our bodies don't see a difference between emotions and thoughts and physical. In Western medicine, we've sort of separated mind and body, right? But I think we all know that if we're feeling an emotion strongly, like just think of grief. Do you feel grief in your head where all our thoughts are supposed to? No, like you feel grief sort of in your lungs, right? Or heartbreak, right? It hurts. It sometimes physically hurts if your heart is broken in your chest, right? So our bodies take these thoughts, these belief systems, these ideas, and they are, I won't even say they turn them into physical and physiological things. They are physical and physiological things. And the idea that we separate these and think that that behavior and thoughts and emotions are over here and physical symptoms are over here, to me is just wrong, to be honest, in my opinion. So some of what I see is physical, but some of what I see is just the body manifesting a belief. It's creating a reality of what the person believes about themselves. This happens especially with digestive issues and with autoimmune issues. I find this a lot. That it's the body taking a belief system or an idea and turning it into a physical symptom or showing it as a physical symptom, the physical symptom aspect of the emotional reality. So yeah, that's not uncommon, especially with digestive stuff.
Now, when you're coming up with sort of suggestions then about how to treat, and I don't know how careful you need to be about using that word or
right.
But ideas for, maybe for supplements or for specific therapy or something like that. Are you, again, this is what the client's sort of body is saying, this is what I need, and communicating that to you so that you can communicate it back either to the person or to the parent.
Right.
So here's my question, though, and this may seem a bit odd, but so again, with a lot of these kids, right, a lot of treatments are really difficult just because of their emotional and behavioral and other things that they're going through. So how are the suggestions their own bodies are giving them ones that you think will work for them because it's coming from them? Or so, do you mean?
No,
does that make sense? So
I mean, that's the theory behind muscle testing, and behind me accessing their innate wisdom, their consciousness, is that all of these things are coming from them. I also, when I do energy healing, which I also do, I'm always working with what the client's body is telling me is going on. What the client's body is telling me the priority is for any kind of healing or treatment or anything like that. So the suggestions that I give, they should be more in line with the client's body. Well, I'll say this. They should be more in line with what the client's body is going to respond to. I do understand the actual difficulties sometimes of having a child who has extreme behavior or emotional issues or just a past history of trying a bunch of stuff and it not working and not wanting to go try one more thing. I understand the reality of that. But, it should be that once they start trying this, even if it's something they're like, oh God, I don't want to try one more thing. I've tried all of this stuff before. It should be that they start seeing some positive results and feeling good. And I would hope that would then, encourage them to go back and try more. So yes, it should be more in line with what the client's body is actually going to respond to. But yeah, the realities of having tried 100 different modalities and trying to convince them to try one more, I get it. Like that's just.
Yeah, I mean that is just an unfortunate reality for a lot of kids, and not everybody, of course. Some people haven't
Yeah.
Yeah, try.
I recommend, and again, these are all just intuitive diagnoses, intuitive recommendations. So I can't say I'm giving a diagnosis. This is just my interpretation. I tend to be very accurate, but this is just my interpretation. But it's going to be sometimes Western medicine, but it's going to be sometimes things that are a little more holistic, a little less invasive. I'm never going to recommend anything about a prescription medication because honestly, you have to talk to your doctor about that. And even if I was going to recommend something about a vitamin or, homeopathic thing, I always encourage people to talk to your doctor about it because they know sort of the bigger picture. That being said, I think if you don't mind me sharing, one of the things I recommended for your daughter was a type of listening system that rewires the brain a little bit. That's not something that's going to necessarily hurt to try, right? So, I tend to personally like to treat myself with more holistic types of treatments, and those are what I try to recommend to my clients because I really do feel like the body has the ability to heal itself given the right tools. And that medications that just cover up symptoms, like I said, aren't getting to the root of healing and aren't really going to be effective in the long term. They'll just be sort of a temporary Band-Aid.
Now, do you ever get any intuitive information about how long somebody may need to go through a certain symptom or condition?
Oh, yeah.
And is that something that you share ever with people? Obviously, I believe we all have free will. So even if,
right,
even if you consider that perhaps you've chosen a certain path for this life,
right,
that, you could still make choices that will alter how that's going to play out, certainly with respect to time. But yeah, I was just kind of curious about that. So is there ever any information that you share about that? Like, well, by the time so-and-so is 20, this will have resolved itself.
Right.
So you can try to tackle it now, or you can wait and see.
That's a good question. Yeah. I think, so the way that I look at it, and this is getting into a little bit of how I believe psychic information works, and it gets into a little bit of quantum physics. I think I'm reading the most likely probability collapse. If you know anything about physics, you know that reality is just the probability that's collapsed in every given moment. And in theory, there's all these different parallel universes where different probabilities have collapsed that are going on at the same time. But we're in this one. So what I'm reading is the most likely probability collapse right now when I'm giving you the reading. Things can change. So if you start changing your behavior or your actions, or you take a different course of action, then that's going to change the probability that something's going to happen. So when I'm doing a reading, it's just what's most likely to happen right now if you continue the course you're going on in the same way. But yes, I do believe in free will. I do believe that things can change. So I don't tend to give necessarily hard timelines. If I do, I couch it in like, this is what's most likely to happen according to what I'm seeing right now. But if you change it up and do something different with your life, or try a different treatment, or, do some EFT tapping or something like that, and really are able to shift some things. If you come back to me in 6 months, I'm going to see something different because you're a different person now, because you changed the probabilities. Does that answer your question?
Yeah, thank you. And so that raises the other question, because I think people are probably wondering, like, how often do people then come back? Do they go off and maybe they'll implement one or two of the things that you suggested and see how it goes? And I mean, obviously, if symptoms disappeared and life was wonderful, there'd be no reason to return. But our kids are, generally speaking, pretty complicated, complex. I mean, as are we all. But so my guess is that it's likely that, might see some shifts, maybe other things emerge. Is there sort of a, it's good to check in again in 3 months, or is it completely play it by ear, what feels right for anybody?
Yeah, I mean, I think it's people. I think people's health issues and emotional issues, it's like an onion. So when I tune into a client, I always ask, what is the priority for this client? And to me, that's like the outer layer of the onion. what's the first thing that their body mind wants to work on right now? And so that's usually where I'm getting information. And the reason I like doing that is because their body knows the correct order that this needs to heal, right? If you fix a symptom, but you didn't really fix what's going on underneath, like the giant part of the iceberg that's underneath, the symptom's just going to come back, or some other symptom's going to come back, right? That comes up because of this. So I think that what I'm usually doing in the first session is sort of whatever is the most pressing for that client's, their innate wisdom's priority of what they're saying is most pressing. So yes, usually people come, we do a session, they see some progress. I wish that I could, have one session and fix everything. But that's not how it works usually, depending again on what it is. If it's just a minor problem that just happened to pop up 3 months ago, yes, sometimes that's how it works. But with people that have symptoms that have been going on for years and complicated things, it's usually not just one session. So usually what will happen is clients will come and they'll do one session. I'll give some recommendations. Sometimes one of the recommendations is one of the type of energy healings I know how to do, in which case we could book some follow-up sessions just to do some actual healing work. But if it's not me, if that's not the priority I get that's important for them, they'll go off, they'll try some certain things. And then when they see results, they'll come back to me and they'll be like, wow, this was great. Let's do more. And in that case, I do offer sort of packages. You can buy a certain number of sessions to be used in 6 months. And then we can go in and sort of do, another session to get the next layer of the onion. Go off and try some stuff on that. Do another session to get the next layer of the onion. And I can actually muscle test even when would be the best time to have the next session as well. So do you need to try this stuff for a week? Does it need to be a month? Is this, that kind of thing. So.
Yeah, that's so interesting. Do you have examples that you could share? Obviously not revealing any identifying information of some other, kids kind of that may be similar to some of the children of the parents or the professionals who are watching right now.
Yeah.
And sort of, how you worked with them and maybe some of the unusual information that you may have found that, a sort of standard Western medical doctor might not have uncovered.
Yeah. I think that, without getting into too much detail about specific, because especially with kids, I don't like to reveal sort of too many details. But most commonly, I think the things I see, so there's usually a diagnosis, like you said, it can be an emotional diagnosis like ODD or even something like autism, that there's usually a lot of stuff going on at the same time. The medical term for it, which is a horrible term, is comorbid conditions, which means there's more than one condition going on at the same time, which for most people is usually the case. So a lot of the information I get is maybe about some of the other things that are going on that weren't the primary symptoms and so didn't necessarily get flagged for diagnosis. Sort of like you said with your daughter's digestion, sort of that kind of thing. Like, I don't know if that's something that necessarily you've had a medical diagnosis about, I don't know, gastritis or something like that. So it's additional information about things that maybe weren't flagged by the doctor. A lot of it, though, especially with the kids I work with that are nonverbal, is that sort of information about belief systems and emotions and things like that they can't communicate to their doctor because they're nonverbal. So there's usually a wealth of information that I can get about different symptoms or different things that are going on that the child may not have been able to communicate to the parent in that way. But yeah, usually it's about sort of some of the more periphery things that are going on, like digestive stuff or other neurological stuff that's going on, allergies, things like that, that will come up for these kids. So it's sort of building a bigger picture of what's going on than maybe they necessarily get from their Western doctor.
Got it. Okay. I wanted to make sure that we also had a chance to talk about the sort of cycles of healing. We started talking about this when we had a conversation about doing this interview, and I just was wondering if you could share a little bit about what you have learned about really how the body goes about its healing process, because of course as parents we're gunning for the for the end of the, you know, we just want to get there, the destination at the end, and but that's not really the way healing works, as you understand it, right? So can you explain a little bit more about that?
Sure. So I feel like probably the best metaphor to look at this is there's a aspect of Chinese medicine called the 5 elements. And basically it's saying, if you look at it sort of like the seasons, right? That there's different seasons or a different time for different things. So, you know, we're coming into spring now. Spring is all about growth and making progress. And, you know, so you can look at it as that's the healing time, right? That's the time when a lot of actual healing happens, where you see a big change in symptoms. But then what happens with the body is it gets to a point where it's like, whoa, that was a lot of change. I need to acclimate for a while. You know, if I keep growing and I keep moving, you're gonna go into what's called a healing crisis, where there's too much healing happening all at once, and the body sort of almost has this sort of reaction to it. So everybody's body has a pace that they want to heal. And it's important to respect that, because if you overwhelm the body and do too much healing all at once, the body is going to be confused, it's going to react, it's going to not know what's going on, it's not going to have time to fully communicate with everything that's going on in the body mind about the changes. So it's important to respect. I think we talked about punctuated equilibrium a little bit when I brought this up.
Which is a mouthful, so help unpack that for us.
So, punctuated equilibrium is actually a term I first learned about when I was studying evolution. And evolution doesn't happen as a constant change. What actually happens is there's a lot of evolution over a short period of time, and then nothing happens in the genetic code for a really, really long time. And then there's another period where something happens very quickly in a short amount of time. And of
course, by short amount of time for evolution, we're still talking about...
I'm still talking about tens of thousands of years.
A long time, but...
Exactly.
As an analogy, it works well, though.
Geologically speaking.
Right, okay.
The same thing is true with almost anything that grows or changes. You know, the more I sort of studied biology and physiology and all of these things, I saw that it was true in people as well. That you can make some changes, and then things want to sort of stay status quo for a little bit to sort of integrate those changes. And then that's when the next layer of the onion is sort of ready to be transformed, right? So if you peel it off all too fast, the body just is not going to be able to cope with that. But if you sort of respect the body and say, okay, let's do this chunk of change, and then let's let you integrate and let you figure out, you know, shift things that need to be shifted and get them back in line. And then once that's done, we can do the next phase of healing. And again, that's one of the reasons I love the applied kinesiology, is I can actually muscle test, is it time for the next healing yet? And if I get a no, I respect that. And so, you know, with some things it can be a week between healings. With some things it can be, you know, months between healings. It just depends on how long it takes that person's body to integrate the information. But without giving that time and space for the healing to really settle and become part of that person's new consciousness, you can have problems if you do too much healing too fast. So it's important to sort of, if you see some changes or you see some progress, be happy about that, and then maybe let things settle a little bit for a little while before you sort of dive right into the next thing or the next phase.
So that raises all sorts of issues, I think, for parents, about allowing the process to unfold in its own time, which is lovely and makes a lot of sense. It feels very natural. And it also is really confusing, because how the heck are you supposed to know when those times are?
Yeah. Yep.
Even for ourselves, I mean, we've gotten so detached from our natural rhythms, I think, as human beings. I mean, so what do? We get sick. That's our body saying, whoa, time for a little rest. you're too stressed, you need a break. I'm gonna flatten you for a week or two so that you can, you can do some healing.
Yeah.
But are there any, short of muscle testing, our kids, which
Right.
I think would be really great to do. And I've never gotten my own muscle testing to the point where I trusted it on myself or my kid, but maybe I'll be inspired to go work on it some more. Are there things you think that parents can do to watch for the rest periods, the integration times, where they can feel okay that nothing's happening,
Right.
but really a lot's happening, it's just not visible?
Right. Yeah. That's a good question. I don't know that I necessarily have a solid answer for that. I mean, I think my answer, which probably isn't going to be the answer you're looking for, is that everyone is intuitive. I don't think I'm special. I think it is something that, like playing the piano, anyone can sort of develop that skill. So, I mean, my answer would be to use your intuition, but I also know as a parent that's really hard when you're in the thick of it to sort of know. Let me think if I have a better answer than that.
Well, but that's not a bad answer. I think, just raising this as an issue, that's something to take into consideration. So maybe as a parent, you do start trying something that you really thought had potential and you're not seeing any results.
Right.
It could be that it's just not the right time for that.
Yeah.
It still might be the right therapy or supplement or whatever. Now,
Yeah.
I get it that's like, how it's like
think?
one
No.
more thing to think about.
You could come see a medical intuitive.
Yeah.
Yeah, no,
Right.
I think that it's I mean, it's important to sort of we've developed, especially in the Western world, we've developed this society where it's constantly grow, 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 go, 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 right? We don't respect that there's cycles to things. There's the birth death cycle, there's the season cycle, and that's how things are. I feel like it's almost pushing against nature to try and be in this world where we're just constantly looking for progress, 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 with no rest and integration periods. I mean, we even have to sleep every night, right? If you don't sleep, you actually go insane, right? So, I think really just coming back into the place where you're respecting that these things happen in cycles. And like you said, it might be a rest cycle time. So it might be that if you try it again in 2 or 3 months or 2 or 3 weeks, that it is more effective. But just sort of respect that, yeah, there's, like you said, there's things going on behind the scenes that you may not see. And that this expectation we have for constant growth or constant forward movement is not how the human body works. It's not how the seasons work. It's not how the universe works. It's not how things work. So to just really respect that there are cycles of, birth, growth, decline, death, birth, growth, decline, death, or the seasons, right? If you think of winter as the death season, winter, spring, summer, fall, winter, spring, summer, fall, that's how things work. Even with
right. And these periods of what appear to be just nada going on are
right.
In fact, there are things going on. We just can't see them. And they may be at a cellular level, maybe at a subtle energy level. It may be at all sorts of different levels that we can't know, but just to sort of trust. So how can people find you and how can they work with you?
Yeah. So you can go to my website, which is just my name, megancaper.com. And there's a work with me page. I do medical intuitive services. I also do animal communication, both for medical issues and also just for other issues. So if you go down to my medical intuitive page, there's a book now button. There's also a button to set up just a call if you just want to chat a little while. And see what I have to say, give me a little bit of background of what's going on, and I can sort of tell you whether or not I think I can help. So that would be the main way. Just go to my webpage and either just book a session or book a consult call, and we can just chat a little bit.
Okay, well, that's great. I have to say, just the information that I got, even just from our little sort of truncated session, it was absolutely fascinating and much, much more specific than I had been thinking that it might be, including like a very specific part of her brain that you were picking up was, not doing something quite properly, and we chat about that maybe another time. But in any case, that is something that I had never considered or thought of, or I think I've heard of it before, but not something that anybody's ever talked with me about as being a possible cause for certain things that we're seeing. And so that was like, that's interesting. Okay, another bit of information, another path to maybe proceed down.
Look down, yeah. I think
Yeah.
too. I don't have any. So when a doctor looks at a patient, they're looking to see the paradigm they're looking at is what syndrome matches the symptoms you're showing me, right? So there's sort of almost already these little blinders on they have when they're looking at things, and they may not look to things that don't necessarily match in their head the list of syndromes that they're checking for, right? Whereas I'm just asking that person's consciousness what the problem is. Show me in my mind's eye, show me however you're going to show me what the problem is. So I think a lot of times I'll pick up something that may not be picked up by a Western doctor just because they already go into an appointment trying to check boxes. Whereas I go into an appointment being like, I'm here to help you. I'm here to heal you. Show me what the best thing is for you to work on right now. So I feel like a lot of times I'll get information about disparate systems that, again, maybe just in addition to something you've already heard or already been told by a doctor, because I'm coming to it with an open mind of I am just looking to serve this person's highest health and highest happiness. Show me what you need to show me, which is a little bit different than a doctor going in thinking, all right, at the end of the day, I have to put a diagnosis down on this patient's chart, right? Can you see how that sort of narrows your thinking a little bit?
Oh yeah, absolutely. And I mean, and that's just an artifact of Western medical care and health insurance and training and everything else.
They've got to put a code down on the form, and there's nothing wrong with that. And I mean, I think there's a lot of alternative medicine practitioners that sort of poo-poo Western medicine, and because I have training in both, I think they both have value. I don't think there's anything wrong with going the Western route. I don't think there's anything wrong with going the alternative route. I think it depends on the person. I think it depends on what you're comfortable with. But I think that they both have, I'm without antibiotics, I wouldn't have made it to the age I am. You know what I mean? So there's definitely things about Western medicine that are super important and vital. And I also think there's other things about holistic modalities that Western medicine doesn't necessarily take into account yet that are super valuable. So that's the other thing too. When I go in and I'm looking at someone's, what's the priority for their health, I'm not hemmed in by one system or another. I'm really I'm trying to take myself out of the picture and just be the witness and ask, what is for this person's highest good? Show me what is for this person's highest good. And without, as much as possible, without having any judgment on the information that's coming in.
That's really a helpful way to explain it. So I think we can probably just leave by inviting people to consider if this resonates with you in any way, if this intrigues you, if you think this might be a nice way to get additional information about what might be going on with your child or with you, if you are facing some mystery issue yourself. And if so, hop on over and check out her website and or book an exploratory call and see if it makes sense. So I want to thank you, Megan, for joining us and helping us understand this. I think it's probably the first exposure for many people to this concept. So thank you for explaining it.
No problem.
Helping.
And yeah, if you have any questions or it still seems weird to you or whatever, please do hop on a call. Like I said, I'm the most scientific woo-woo person you'll ever meet. So I didn't used to believe in this stuff at all. So if you're open-minded enough to give it a chance, please do hop on the phone with me, because I've now been convinced in the power of how well it works. And if I can share this with people who are sort of on the fence about whether or not they believe in this stuff or not, if I can sort of show them a little bit about how powerful it can be, I feel like that's a good day for me. So yeah, please feel free. If you have any curiosity, hop on the phone with me. I promise I won't be waving crystals over your chakras or anything like that. So
we've got other speakers who might
not
do that, but not Megan.
Not maybe what perfectly heals you, but that's not what I do. So.
That's great. Okay. Well, thank you so much for joining us, and thank you everyone for tuning into this interview. And we'll leave it there. All right then. Bye bye, everybody.